Good afternoon again. This is Dr. Bill Wyatt with the American Orthodontic Society. And we're going to have a real jewel here to share with you. It's a multiple problem case, and there's very little that reveals it, how bad it is, looking at the facial structure, other than just a slight shortness of the chin in here. This is a Class 2 Division 2. That's just one of the problems that we've got here, with a deep bite, of course. And we'll also find down the line he's got a second molar that's laying flat down, and a wisdom tooth. All the wisdom teeth have no room at all in there, so we're having them removed. But stick with me on this case. It's got a lot to learn here. If you can just learn how to do cases like this, these other cases won't seem much to you at all. And yet the facial structure looks quite well to start off with. Now, and he looked better when we got through with it. Okay, let's go ahead and see what we've got here. I'm going to have to touch that, I believe. And the shortness of the chin gives it away a little bit. It should be out, but a real nice young man, and really looked quite good. And when you look at the front portion of the face looking back, you can hardly see anything that you would want to change here. I mean, this vertical out of the face is almost ideal. I mean, just that's really good. And the face looks good. The ears, the hair, everything. He's got a few freckles over the nose, but my gosh, he is a nice looking young man. And we'll take the next picture, though, with him smiling, and now you begin to see what's wrong. The upper front teeth came in, and the lip structure pulled them back, and the laterals got up on top of them, and the edge of the central teeth, if you look in a minute, we'll show you, it's almost a quarter of an inch between the edge of the central and the edge of the lateral teeth out here. And this is a typical Class 2 Division 2, and they come down and they lock the jaw. So that's another problem, the jaw's locked back. If he had a tendency for temporal mandibular joint or something went wrong in there, he's already set up with the jaw locked back, but many people have their jaw locked back and don't have the irritation of the retrodiscal tissue, so he's not having any joint pain that we can pick up. But you need to check that out on every person you work with. You know, have them open as wide as they can, measure it, and move the jaw from side to side. If they go to open and they kind of tear it like that in the paw and straighten out, write it down, get it down, because if something goes wrong as you go along with this, it's you that started it, see. So you need to write down every little thing over there and checking these joints out. All right, let's get going on this case. This is a Class 2, Division 2, with a deep bite. You don't even see the bottom teeth. They're up in the roof of his mouth. I don't think I have a picture showing that, but it's obvious where they are. These cuspids now are tilted back like this, so you can tilt them up a little bit and increase the space in here, and they'll still stay there. Now, if these cuspids were tilted this way or were straight and you tilted them that way, they'll come back to this position. But if you take the roots and push them out here, these teeth will not come back. You don't have to go that far with it. You come something like that, and the teeth, they don't have any sacred thing in the human mouth there. makes cuspids come back together. They say you just move them apart like this, and now you leave them alone, they'll come back over their roots. And that's where they got the idea that it didn't matter what you did in there. If you expanded the cuspids, they were going to come back. And that is not true. If you take the roots back, the cuspid is not designed to slide forward like that. So I hate to disagree with the Dr. Little. I believe was a real fine guy, and he's the one that brought this about. But this is not something that we had as students, and they did this real quick. It takes longer to get them back with the roots back. All right, here we go again. Let's erase that, and I'll go on. Now, when we look at it from different angles, you will see that the teeth are pretty well locked in a good position. The upper teeth are lapping out over the lower teeth. So when this person chews, the upper teeth keep the cusp from pinching your lip or your cheek back here. And I've got this little spread out jaw, and I bite my cheeks all the time. It's a real problem when you have the teeth meet wrong. In other words, if the lower arch gets spread out and you're hitting cusp to cusp, you can bite your cheeks real easy right there. Okay, let's go on. Now, here's one thing I want to say. The distance from here to here is nearly 1/4 of an inch. Now, this space will open in just a few months. I mean, like 2 to 3 months, you can have this space back and have these teeth lined up right out here. And we're going to have to open the bite, and then on a lot of these Class 2 Division II cases, the bottom jaw will move forward just almost automatically. You can have to wear a little Class 2 elastics, but I've had them, at least one case, we brought these teeth out of the way and they moved out into Class 3, and I had to bring them back to finish the case up, but that doesn't happen very often. Now, on the bottom, of course, we've got this crowding right here, and these teeth, they have to be back a little bit. You have to tilt them back, and then you can spread this out and line these up. And as you open the bite, you're going to have to lower the lower teeth or something like this, and you'll have to bring them down. And as you do, they will expand themselves, spread out right in that area. Now, we don't see what's happening back here behind this first molar back here. That'll run some people off there. If you think you're going to just do the simple cases, you invariably are going to run into stuff like this. And I'll show you in a minute now. He's got a little mouth breathing problem, I think. It's got this tooth spread out over here, and the upper tooth is meeting inside like that, and that's kind of an indication of mouth breathing, and probably your second molar would be back out there also. Now look, the jaw is locked back right here, so you're going to have to move these teeth out here, and you're going to intrude them some, and you're going to intrude your lower anterior teeth, and this jaw will just want to move out. It's been trapped back there a long time, and these points, if you do nothing to them, they'll tend to go back. In other words, the jaw on its own. But we're going to normally put a little Class 2 elastic force on that as we do it. But some of them just go all the way when you do that at a Class 2 Division II like this. There's just a ton of stuff to learn in this case. Now this is an intruding arch, and it's on top of another arch, and this goes down like that. you raise it up and hook it or piggyback it over this. Now we're using a little narrow brackets all the way. These have a little wing-like thing. Some of them do. These don't, I don't believe. And this is your, as we go down, you tie this arch back here, or these teeth will tilt. They will go to tilt forward more than you want them to go. So you drive the arch back and tie it when you start. You can put this intruding arch on day one, though, and whatever you shape your teeth are in, you can put it on there and put the other arch on and tie it back. Now here we go. Here's the, this was 4 of 90, and this is the Class 2 Division 2, just showing the model, and then we're going to show you where it was after we got through. This is, we started opening, pushing these down and raising this up, and this is lined up, and here it is 12 of 90, and that's 4 of 90. So we have in the 12 of 90, in other words, you got about 7 or 8 months there, and we have these teeth lined up already. And day one, we started intruding this arch, and we have this case lined up. In that much time, the bottom teeth are now out of the roof of the mouth up there, and they're going down even more as we press this intruding wire. We work on it. Now, I hope you, if you're just starting in orthodontics and you tend to get afraid of messing with stuff like this, but take the video and study it. You can do this stuff. It just takes some figuring out sometimes of what you're going to do, and go after it. Don't jump in it overnight, though. Do several, a bunch of simple stuff, and get that under your belt so you know where you're putting these brackets and all this other stuff. Now here's the Class 2 Division 2. We're kind of moving this forward a little bit, not all that much, but you can see how it's blocked off right there. There's the intruding wire again, and there's the teeth, and there are the teeth. Now this is 4 of 90, and there's 12 of 90. In other words, these teeth went from that position out to here in about 7 or 8 months, and we've had some of them do it in 3 or 4 months. We'd have those teeth out there like that. And with your intruding arch, you can speed up your case about a couple of months, really. So we got them out there 12 of 90, but we haven't looked behind the second molars yet. And there we are, 4 of 90 where we started, and there it is at 12 of 90. So this gives you some idea, and everybody's teeth don't move at the same rate. Here now we've got this intruding arch tied on top of the other arch. It's kind of piggybacks over. So it's leveling this out as this small arch wire underneath here is straightening each tooth, going around the rotation and all this. Now this is going to have to come out, you see, and line up a little better right there. And the teeth are sitting in good. Now here's on the left side, the second molar looks good. Over here, it's not there. We don't see it yet. All right, let's go. We're looking at the X-rays. Now this was 3 of 90, and he's 14 years old at this point. And you can see those lower anteriors right up there touching the teeth and locking this jaw, keep it from coming forward. And look at a hornet's nest right here, right in that part of the jaw. Now we'll say here's the second Panorex that we took right here, and this was 3 of 90, and he's 14 years, And at this point, we saw the jaw is turning up here. So there's nowhere way we're going to get that wisdom tooth room in there, but we got the second molar lined up in here pretty good, and the second molar up above is doing pretty good, and we send them in or recommend they go to an oral surgeon or somebody and get those wisdom teeth out. Now don't let a tooth like this scare you. You can take this out or you can leave it in there. You can straighten this tooth up with this in here. It'll just shove it back up in here somewhere. But we don't need it, so it made it quicker to take this tooth out or have it removed. So we had that tooth removed, and you can see where these cuspids are lined up with a little tilt forward there. Now let's go to the next pyrexby number. Well, no, this is number 1. This was back where we saw this right here, so we recommend we take those out. And now I think we'll go to number 3. Yeah. Here's number 3. This tooth is gone off of here, out of there, and we left the others there, but we had to get the lower to get it taken. So I think we took both lowers, left the uppers alone. Now, you have to get to the side of a tooth like this. So you take electrosurge and maybe take a little tissue. Then you put a tube over here, and then you build a little spring-like device that comes in that tube, and you can move it around like that and head it off in this direction and build a hook in it. And you can put it in there and stick it in, pull it up and hook it behind one of these brackets right here. And that tooth will come up, and it'll actually make a space between the two teeth when it comes up. So let's look at, this is 3 of 91, and he's 15 years and 8 months old. And so we need to get on with this. All right, here it is. He's 15 years and 7 months now, and we've got the tooth. See, we bonded that stuck over this little hook. Wire was over here, and it picked that tooth up that far. Then here is the little spring. See, we had a different spring went out like this. And then we went that. And when you pull this up, you tighten that up, you see, and it kicks this tooth out. Now while you've got that pressure on it, you pull it forward and close this space right there. And I'm not pulling your leg or trying to anything. I have never found a tooth that you couldn't upright. And it didn't matter whether they had orthodontics done or were in the middle of orthodontics or never had any done. You can upright any tooth in somebody's mouth if you can just open up and get to a place on the side of them and put one of these little springs on it. I have never had one that wouldn't do it. It'll push the tooth there backwards if there's another tooth in there, and it'll still come up. And don't grind off this tooth. Let them run together, and they'll push each other in place, and they'll line up straight like that. And so that ought to help you. I don't care if you're doing orthodontics. If you want to do it, learn how to do it. And if you don't want to do it, go show it or give it to somebody or take it where somebody else can do it. I don't know that all the orthodontic schools show people how to take the teeth up like that. I've seen some crazy things, how they were trying to upright teeth like that. And it's real simple. If you just take the time to go to the side, take electrosurge, or if you don't do it with a laser, trim it off, etch it, put a little tube on the side, and I do it with rectangular wire. If you put a lot of pressure on a round wire, it may roll the tooth one way or the other. So we do it with rectangular wire. Now there's the tooth. This is Panrex number 6, and he's 17 years old, and we're taking this thing out of there. The cuspers look awful tilted at that point, and that's number 6. And here he is in 1993. I think we took the braces off the bottom. You notice how we dropped the way down here. It doesn't matter where you put them down here, as long as you got your incisal edge up here. You can hide the lower brackets if you want to. In fact, you can come along these and drop them down, raise this up, come on back in that way. Or you can, if the clinical crown is long, you can get down low on it, and the person doesn't even see the bottom teeth, the brackets on them. And this is here, I think we're about the end of this case. There's the other side. We're class 1 now, and there's this area. We put a bite plate of retainer in there. The wires go back in. We have a bite on this section right up here. And as long as he wears that retainer, that will not deepen again. If it deepens, he could have some problem with it. Now there's the bottom. I don't have a 3-to-3 on there, but I normally will bond a 3-to-3 right across from these like that, and bond it to each of these teeth just to make sure that it stays there. If he wears the retainer, he probably won't even need one like that. That's the upper, and that's the end of this case as far as I'm showing it. I'm glad that you watched this thing. You can do it, and I'm not an official orthodontist, but I've been doing this stuff for my first case I did in 1956, but I'd done nothing but orthodontics since 1970. So from 70 to 100, and then I've got really about 50-something years of doing orthodontics. And it is a wonderful profession, and it is so gratifying to take somebody, especially as having pain with their joints, and working on it, and you can get rid of the pain on just virtually everybody by how you do the jaw. They can have arthritis and trauma and things, but if it's just plain dealing with the teeth and the arthritis, you can usually get everybody out of pain. Thank you for watching, and I'm going to close out and say goodbye. I hope you'll join our group and subscribe to it. We have people all over the world, really. We've got over 5,000 people that are subscribed, and I hope you'll join the group, and I'm going to try to keep putting this stuff out. People just don't live long enough, but as you get older, you get more and more problems. So I'm going to say goodbye, and I'll see you in another video, hopefully. Bye-bye.